Hello, everyone. And for those of you who do not know me, I am Laura Tisson. Are there any Pittsburgh folks in the chat room tonight? Pittsburgh, you're letting me down. All right. From previous surveys, we do know that a topic of interest to our CureJM families is knowing more about exercise. So I thank you for inviting me to be able to discuss this with those of you that are available tonight. So just to give a little bit of background, we know that juvenile myositis is caused by inflammation that's basically affecting the striated muscles, ultimately leading to weakness. This inflammation is in the skin as well. Untreated disease can lead to even more persistent weakness, muscle dysfunction, and ultimately disability. So therefore, our children are not able to really live the quality of life that they definitely deserve. The way we monitor disease is by really following symptoms. If the children are having difficulty getting off the floor, getting out of bed, if they're having endurance issues, fatigue, and then comparing that to what we see on an exam. So being able to actually test their true muscle strength, seeing if we see any skin findings that are showing us signs that the disease may be flaring, and comparing this to some of our laboratory assessments with any of the elevations of their muscle enzymes. And then some of your physicians may be trending what we call core set measures, which are different questionnaires that either the child or the parents can complete in different ways of actually measuring their true functional ability. And so the reason behind JDM is that the immune system is becoming dysfunctional. The immune cells that are actually being produced are attacking the small little blood vessels that run in between the muscles. And then this allows those blood vessels to become leaky, making those inflammatory cells actually leak out and then go into the muscles and affect them. And therefore then with the muscles having the inflammation, they trigger the immune system to produce even more inflammation, and kind of that feedback loop just keeps going. And so we know that the muscle inflammation and the pain is ultimately causing the perfusion of that muscle to not be able to actually have the true capability of what it should. And so therefore they're having, those muscles are not as strong as what they could be. And this ultimately is limiting their activity, them having endurance issues, and then these children becoming more deconditioned. And then that's ultimately making them not want to participate in sports or do the things that they enjoy. And unfortunately, the cycle just keeps perpetuating. And so we know this, but what do we do about it? And so multiple studies have also been done to actually truly confirm that these kids that have myositis are deconditioned. And they've been looking at their exercise capability, comparing them to healthy children. But what's actually interesting is we're knowing that this deconditioning actually continues. So it's not just when these kids have active disease, that studies are actually showing that when these kids are even in remission, even up to 20 years, that compared to healthy kids, that their cardiorespiratory fitness is actually still lower. And so we have all this information, but now we need to know, what do we do about it? And so Dr. Brian Feldman, who's on the CureJM Medical Advisory Board, his main interest is actually looking at exercise as a medicine, not only as a way of being able to kind of monitor kids, but being able to actually intervene and see if we can actually help these kids do better. And so one of the things that he's looking into is creatine supplementation. So creatine is kind of the precursor for energy for those muscles to actually for them to actually contract. And so he's looking at, if we supplement these kids, are their muscles actually functioning better? And he is showing some promising results. It's still kind of in the works, so I don't want to say any specific numbers yet, but I think he'll be excited in the next few months to kind of hear more about that. And so we know that exercise is safe. Studies have shown us that that when these kids are exercising, that it's not causing them to flare. One study kind of looked at doing push-ups and sit-ups and jumping jacks, And again, they had no signs of flare. One study that was done in 2012 actually looked at 10 kids with juvenile dermatomyositis that they enrolled them in 12 weeks of exercise training that involved them running on the treadmill, doing stretching, doing actually weight resistance. And all of these kids ended up having an improvement in their muscle strength and function. Their bone and muscle mass improved, their disease activity improved, and actually their quality of life all improved too. And none of these children flared. So we know that exercise is safe. And we know that it can be a form of medicine. So kind of these two backbones is what led Dr. Bruner and myself to actually come up with our study, which the nickname of it is AMUSE, and that stands for Analyze Myositis with Ultrasound and Exercise. And so there's two parts to it. One part is actually using the Fitbit, which is one of those personal activity monitors that you can actually attach to your waist. And it's able to record the amount of steps that these kids are taking. So actually getting a true objective measure of their exercise, as opposed to just saying, oh, well, I think, the child's not running as much as they are, or, not really getting a true quantification to that number. This actually allows us to have steps that we can follow and that we can trend. And then the second part of it is using ultrasound and kind of the latest and the newest modalities within ultrasound to be able to look at the texture, the consistency of the muscle, but also the perfusion of the muscle with those small capillaries that before we were unable to. Since this is a pilot study, we definitely have to also test the reliability and the validity and responsiveness of these two tools to confirm that we're actually testing what we want to be testing. And so right now, looking at results for the ultrasound is I'm able to show that over 6 months, the kids that actually have active disease, that their affected muscle being the upper leg, the proximal muscles, that they're actually stiffer, and that the speed of perfusion is actually slower over time after exercise. And this is all compared to those that do not that have stable disease. And so what I'm thinking is actually going on is as the disease is improving, that edema, the infiltration, the things that are infiltrating that muscle that make it squishy are actually resolving and allowing that muscle to kind of return to its original stiffness, and therefore appropriately allowing it to be able to be perfused and be able to have the capability of what it really should. Another interesting finding is that by looking at, again, more of the perfusion within those capillaries, that subjects that had active disease, that they ended up having less capillary enhancement compared to stable patients. But over time, this trend actually continued for those that had the active disease, but those with stable disease, their perfusion in that upper muscle improved after exercise, which is what you should see. So as you're moving, as you're exercising, and we do this ultrasound, the perfusion of that muscle should improve. But at baseline, I wasn't seeing this in all the stable kids, but over time I did. So what I'm thinking is that some of these kids that we're saying are completely stable, that their labs are looking good, their imaging may be looking good, but they're still having a little bit of that fatigue, that it's that those capillaries still have a little bit of damage, that they're not 100% okay yet. But over time, I was able to see that this actually resolved and that the muscle was able to perform how it's supposed to. And so when looking at the Fitbit, what Dr. Bruner was able to see is that those that had stable disease were definitely moving and more active than those that had active disease, as you would anticipate. But over time, the active disease patients had an increase in their step counts compared to the stable kids. This trend we see more between the 0 and the 3 month. Whereas it kind of fizzled out between the 3 months and the 6 months. And, that's not unexpected, since, you give a kid a new toy and they're super excited, they're going to use it every day, but then it kind of gets old and they kind of stop using it. But we definitely got enough data to be able to say that these kids that were moving around, no one flared. And that Dr. Bruner was able to show that the amount of steps and the amount of physical activity that they are doing correlates to all the other outcome measures that we use. Their muscle strength, the questionnaires on, you know, how the kids are doing, what the families think. So being able to actually see that this is correlating with some of our other tools is definitely a new finding. And so basically the implications of these two is that we can actually use these tools to improve some of our outcome measures, and actually being able to monitor our kids and their treatment response. I think the biggest issue that we have is that we have those kids that maybe they don't have a rash, you know, you do their muscle strength and they're pretty good, you know, there's maybe some small, like they're not your 5 out of 5, maybe they're your 4+ out of 5. But there are really no other complaints. Their labs are all looking good, but yet they're still having a little bit of fatigue and a little bit of endurance issues. And we run into this a lot, that we don't know how much of that is truly the disease versus them being deconditioned and just, you know, they're hanging out on the couch, they're playing with their iPhones, and they're just not really moving around, you know, a lot. And so that's where we hope that actually ultrasound can be able to help tell us more about the perfusion of that muscle, and does that muscle have the true capability of being able to work how it's supposed to, or is it just that child's choosing just to not move around and that's just what they want to do. So I'm hoping in the future that these can actually replace the need of actually performing ultrasound, or MRI. And so I think the biggest advice that I would have, just kind of based on the background research that we've done and kind of where the research is moving, is that we want these kids to move around. We want them to be physically active. You know, maybe starting off slow at the very beginning, doing more passive range of motion, but then gradually increasing it to doing more of that aerobic conditioning, the muscle resistance training, and stretching, to make sure that we don't get into that cycle of these kids being deconditioned and that muscle just being like, well, if you don't want to work, then I won't perfuse it as much as I should, and we'll just leave it at that. So kind of forcing that muscle to be able to be used and getting that memory back, I think is something that's really important. I think we need to do this combined with a trained physical therapist. And I can see ultimately us having a better way in the sense of coming up with a true training protocol and being able to say that, okay, this has been tested. We know that this is the type of exercise that's going to improve the most. We don't have that information yet, but I can see over the next few years that we will. All right, any questions? I think there's some questions that are coming in, so let me see.
If anyone would like to use the Zoom group chat to write questions, you can do that. Or if you'd like to ask Dr. Tizan directly, please unmute yourself, because everybody, the whole group now is on mute, just to minimize the background noise. Please go ahead and unmute yourself and then go ahead and ask.
Hi, this is Randy Putt. My granddaughter, who is now 11, has been a JDM patient for almost 7 years. And she, my daughter's has done a very good job of keeping her physically active. And one thing that she did early on was to get in the pool and swim. And she started doing that as soon as she, got out of the hospital and got back to trying to do normal things, even when she was on medication. And she has gone through a period of remission and then a flare, and now she's back approaching remission again. But she has kept very, very active with swimming and other day-to-day activities. So it's not it's just some information that may help support what you're telling me. And I think that is, that's really, really exciting news, to think that kids actually doing more exercising, working their muscles really will improve their outcomes.
100%. And that's where I think our field has changed tremendously. I would say 40, 50 years ago, it was more that if these kids and even adults were becoming sick, that they were bed bound. And, you know, the school of thought was they can't move until everything's normal. And those are the ones that did the worst. We want those muscles, we want those joints to move, and we don't want contractures to be, you know, developing. We don't want that muscle shrinking and becoming more atrophic. And so I think there is a very fine line between that muscle being perfused correctly because of the inflammation, and then also that muscle being, well, we've gone so long with it not being perfused, do we need to reperfuse it? And kind of the more you move around, the more we're exercising, it's making that muscle say, okay, you want me to work, I gotta work, and it kicks it back almost. I think our bodies are amazing machinery, but it just takes a little bit for it to become, you know, chaotic and for it to shut off. So that's where we need that reinforcement to say, you know, it's going to be difficult at first, but you need to move around. We need to get you to back. And that also, I think, mentally helps these kids to say, you know, I'm sick right now, but I'm not going to be sick forever. I'm going to be a kid, and it's treating them like a kid, letting them do kid things. And again, we all know the more you're moving around, the more you're exercising, you're going to sleep even better, you know, at the end of the day. And that cycle of not sleeping and fatigue, it's just, yeah. But yes, I think, you know, again, swimming is fantastic, and it's just getting these kids moving sooner.
No, a brief comment. I know it was very difficult early on when she got out of the hospital because she had all the steroid puffiness, and she tired easily. So swimming was a way in which she could use her muscles without, increase her core strength without as much seemingly effort to the child as if you're running or walking or playing sports or whatever. So it may be a good way to introduce the physical activity until they're stronger, and then they can do other things.
Yes.
Thank you.
You're welcome. Thank you. All right, I have some questions. Do you want to read the questions off, or?
I have a question about pain. Can I ask that, or did you want to go to?
I mean, I can try to answer it.
Okay, so so my daughter's 16, and she had a big flare a year ago, and that we're still actually recovering from, as far as fatigue and weakness and muscle pain. We have been trying to get her to exercise more, and we have a recumbent bike at home, and we've got her going to a massage therapist now. But she says when she exercises that her muscles hurt more. And I was wondering if that was something that you addressed in your study, and if you found that improved over time.
No, I didn't see kids in my study actually having pain while they were exercising. I think it is a common thing that when you're moving around, you know, and you're exercising more than you would, you're going to definitely have pain afterwards. But whether that pain's from inflammation or that pain's from the deconditioning aspect of it is really hard to tell. The myositis pain is if anything more mild. So I would say if the child's describing more kind of sharp throbbing pain afterwards, that slowly improves, that's probably just the deconditioning aspect and that muscle just kind of waking back up. But that's where the cycle is that then kids become scared to work out because they know they have that little bit of pain, and then it just keeps circling. So it's very difficult to kind of remind them, you know, you have to push through a little bit to feel that reward at the end. And that's where I think we run into issues too. So, and that's where like a physical therapist, having somebody that's trained with it that can actually slowly, gradually increase it, and can work really well with that child one-on-one. I know even just saying that's a lot easier said than done, is finding the right, you know, connection for them to actually take that, you know, interest and be able to develop an individualized plan that you can do at home and whatnot. But, yeah, I don't know if that answered it in such a way, but you're not alone with it, but it's just trying to get that cycle. It's somehow trying to break that cycle so that it doesn't become to the point of that deconditioning and then just kind of giving up. And so it's keep doing what you're doing. We know that pain is not going to cause her to flare. And
Okay.
It's almost reassuring her that yes, there is going to be some pain there, but it's not going to cause you to flare. And so it's maybe her knowing that can help, and can just kind of give her that knowledge. Then she can kind of push through it and see if over time it improves.
All right, that's great. Thank you.
All right, I think there's some questions here. Is there any risk that injury from exercise can lead to a flare? That is a good question. So whenever your body's under stress, that's stress from an infection, mental stress, stress from an injury, that's going to cause your immune system to kind of wake up and want to see if it can kind of help out. And so I think there is always that small chance if it's more like a broken bone, but not like it's a small twist or a rolling of the ankle that's going to produce a flare. I'll have to look into more, but I don't think I've seen any studies with them actually having true like sports related injuries leading to a flare. But just that general concept that if your child's sick from the flu, your body is going to be overactive and try to fight off that infection. It's almost the same thing that if you have an injury, your body is going to try to get revved up to try to repair it. And so, what is it going to do then to, other things? But I would say I don't see any large actual evidence of that causing a flare, or at least nothing that's been published. All right. Then I have another question. Even for a child without muscle weakness symptoms, so like my 4-year-old daughter who mainly has skin symptoms, do you recommend additional exercise? She's very active at home and goes to gymnastics every other week. So what we do know about the skin is that the skin is one of those obvious signs that your body has inflammation. What's hard is that, we're not able to see what's going on to those blood vessels that are going around the lungs and the intestines and in, the muscles. If those blood vessels have never been involved, it's not to say that they may not develop down the road. But I don't think it's to the point of saying that they need to be so rigorous in a physical therapy program, 3 times a week. I think it's just more, letting the child be a child and then doing gymnastics and then, being active at home. I think it's when you run into that situation that their skin's flaring and just, again, with technology, we're becoming couch potatoes. So then the kids are just staying inside more. And then that ultimately is going to lead to the deconditioning. And then what does that do to your body down the road? But I would say, if she's not having any signs of muscle weakness truly, then just letting her be a kid and, a 4-year-old's going to do enough exercise on their own most of the time. So I don't think you need to do anything in addition, to that. All right, one question's about the new steroid option. And yes, it's still in the research trial phase. And so we're not able to actually be, prescribing that at this point. But it is showing really good, results. We just need to wait until it's fully studied before it comes out on the actual market. And then another question is about if the slides will be able to be available for everyone to see. And yes, they will be. And then another question about, can a flare show up as muscle tightness and not necessarily pain? And again, I think in general, when it comes to a flare, it's not going to be just that one time, Charlie horse pain and then it goes away. So it's more seeing the trend and how it changes over time. And so, every child's going to have a different thing that's what's going to be their way that they show a flare. So if your child's starting to have muscle tightness and it's progressively worse over weeks to months, then yes, that deserves to be evaluated with labs, potentially imaging, a good physical exam, obviously first and foremost. But if it's more muscle tightness at the end of the day before they go to bed, but they wake up, they feel fine, then no, that's just, again, whether it's deconditioning or just they were more active during the day and, multiple other things as opposed to it being a flare from the actual underlying disease. Another question is that an ultrasound may be better than an MRI. And is this something that doctors are starting to use? We had to put my son under for an MRI because he was too young, but would love to get scans. And that's the biggest thing that I'm trying to show is, can there be a way that maybe we don't have to image these kids so much? I think MRI still serves a very valuable purpose. So it's not that at this point ultrasound can replace it. Maybe down the road, yes. I think it's just those in-between cases of, you know, what that muscle is actually doing. And so I think having the actual MRI as a baseline is always a good idea because there's so many other things that can kind of look like JDM, but maybe be something different. And so having that actual MRI to document it of that entire muscle is a really good thing. So at this point, it's not replacing it. Maybe down the road, yes. But at this point, it's giving us more information about the true perfusion of that muscle, which on just a basic MRI, we're not able to truly appreciate. And yeah, I think there's a few questions about using ultrasound instead of MRI. We're not there yet. And the issue when it comes to ultrasound is really who's the operator, who's the person that's truly doing it. And so I didn't talk about it too much here, but I can see if I can have this slide be available later on. But one of the ways that I'm actually doing the true perfusion of that muscle does require an actual IV. So it's with an agent that's actually these small little micro bubbles that gets perfused into the actual muscle. And so the kid can blow it out within 10 minutes. So it's very short acting. But that's how we're able to get more information. And so obviously placing an IV in a 4-year-old, you know, they're not going to like that too. So a lot of times we've been able to do this with when they're going to have their lab work done, or when they're already going to be admitted for an infusion. So it's not necessarily that this is for a diagnostic purpose yet. It's more to kind of help trend to see if they're responding to treatment, because otherwise doing an MRI every few months is extremely expensive and, you know, may require the actual sedation. Whereas training the ultrasound is a lot easier to do. You can do it as an outpatient, you know, in the clinic. So that just makes it more feasible. All right, is there any other questions that I didn't answer or that I skipped? All right, the reason behind endurance issues after the kids have been in remission, that's what I'm still trying to find out. Is it because those small little blood vessels, the capillaries that perfuse that muscle, are actually still showing signs of damage, and it just takes a little bit longer for them to resolve? And that's what you know, we know that these kids have endurance issues. It's just figuring out, like, how can we truly intervene sooner to prevent it from even getting to that point. And unfortunately, the way that we monitor, you know, disease now, the labs and MRI, just doing their physical exam may not be enough to say if there still is any even little bit active, you know, disease still kind of lingering. And that's the whole purpose, that maybe ultrasound can be able to help aid us and show us that maybe there is something that's still there. And so maybe not tapering medications as quickly, or, you know, or doing other things to actually being able to say that, no, this muscle now, these capillaries are doing what they should, the muscle is good, and the endurance is coming just from some other issues. And then another question is about injury and calcinosis. Anytime I break a bone or seem to have trauma somewhere, a calcinosis forms, usually under the skin, not where it can be picked or opened, but from the outside. Unfortunately, yes, that is very common. Any trauma scratching even, anything kind of done to the skin kind of sends that signal to your immune system that, okay, there's something going on there, let's try to creep and crawl and see if we can, you know, get in. And then most of the time, that's how the calcinosis forms. And that's why we try not to do surgery on them. because surgery is just going to make your body kind of send those same signals, and the calcinosis can become worse. But yes, when you're saying that if you break a bone or if there's any trauma, that's pretty common. We also see it if people ever get tattoos or have bug bites, or again, any trauma that affects the skin. Is it standard practice to do a repeat MRI anytime after diagnosis? This patient is coming close to the 2-year mark, and she had severe muscle weakness, so they're starting to actually taper meds. When it comes to standard of care, that's kind of a tricky thing to say with repeating the actual MRI. It's really patient dependent. Some providers, feel comfortable that when they start to taper, as long as, again, you're showing those signs that the kid's doing well, that you don't need to repeat an actual image. Others like to repeat the image before actually tapering. So it just kind of depends on where the child is, and never wrong to ask and to bring that conversation up. Is just saying, hey, I just want to make sure things are okay. As long as you're aware of the cost to it, if your child needs sedation and, the risks that go along with it. Most of the time that's not something that would, be a debate. If you are interested in it and, you have a conversation with your provider, then repeating it just to see where things are, why not? Actually, some providers are actually doing muscle biopsies, and that's where it gets into that, how invasive do we get before we know that things are good, before we start to wean things, and that's kind of different around the board too at this point. There are, and I think it really does depend on the child, because again, if you're having that child that they're bouncing off the walls, they look fantastic, then you can wean things and see how it goes, versus the child that's still kind of sluggish, a little fatigued. That's the one that you're going to do maybe some extra imaging, maybe a muscle biopsy. But really, I think it comes down to the individual child.
Great. Well, Dr. Tassan, thank you so much for this very illuminating presentation. It was, I think, just based on the questions that we had and the number of people on the call, this has been very informative, and I want to thank you for your time. Thank you.
Anytime. Thank you. Thank you. My pleasure.